Greetings, I'm Adriana Miranda from Faculty of Medicine, University of Indonesia. Thank you for the Beyond Science Initiative and International Remote Conference for the opportunity to present a review I made with my colleague, Dr. Cosmas Rinaldi Alismana from the Cipto Mangunkusumo National General Hospital, titled Liver Function Test Abnormalities as Prognostic Factors of COVID-19 Severity, a literature review. Firstly, the prevalence and the mortality rate of coronavirus disease 2019 or COVID-19 are still increasing. And recent reports have shown that while COVID-19 mainly affects respiratory system, the SARS-CoV-2 or the virus which causes COVID-19 can also affect other organ systems, including hepatobiliary systems. And one of the major issues in COVID-19 patient management is the short time frame of COVID-19 severity progression. One study in Wuhan showed that the time frame between onset of symptoms and ARDS, or the acute respiratory distress symptoms, is only 9 days. This highlights the need for accurate COVID-19 prognosis factors. Because with these factors, the healthcare workers will be able to stratify patients based on their risk of severity progression, and thus they can tailor more effective management and monitoring system based on that risk. The aim of our review is to evaluate the clinical significance of liver function test abnormalities as prognostic factors of COVID-19 severity progression. For this review, we conducted literature search from 5 databases: PubMed, Cochrane, Scopus, Medline, and Springerling in May 2020. And we conducted critical appraisal for the included studies using CEBM, or Center of Evidence-Based Medicine Worksheet 2018 from the University of Oxford in the UK. And our inclusion criteria is as follows. So we included studies which evaluate the clinical significance of liver function tests upon hospital admission as prognostic factors of COVID-19 severity progression. And the study type we included are systematic reviews, meta-analysis, and cohort studies. And because we are fluent in English, only in English and Indonesian, we only include articles written in English and Indonesian languages. And exclusion criteria is if the full text of the research is not available, if it's still an ongoing research, and if the study type is editorial or case report. And this is the result of our appraisal. Based on the CEBM, we found that the included studies have high level of evidence because we included 4 systematic review and meta-analysis and 3 cohort studies. And as you can see here, all the intervention is liver function test upon admission. And also based on CEBM, the studies here have high validity, and this is the result of the parameters studied by studies. So some studies only studied 2 liver function tests, such as this Paruhan et al., which studies ALT, AST, and so Paruhan studied 4 liver function tests, so ALT, AST, albumin, and bilirubin, while many other studies also evaluate other liver function tests, but they only find 1 clinically significant factor. So based on what we found, we know that abnormal liver function tests have the potential to be utilized as prognostic factors for COVID-19 severity. And so the liver function tests studied and the included studies in this review are alanine transferase or ALT, aspartate transaminase or AST, total bilirubin, albumin, alkaline phosphatase or ALP, and gamma glutamyl transferase or GGT. However, there are still conflicting results because there are different clinically significant factors after adjustment to other prognostic factors among the included studies. So Zhang et al., a cohort study, showed that only ALT is clinically significant, while Omrani-Nava et al., also a cohort study, showed that AST is the one which is clinically significant. And the cause of this liver function test abnormalities can be acute liver injury due to COVID-19 because recent case reports about COVID-19 patient autopsy showed that COVID-19 causes hepatitis and or existing chronic liver diseases. However, the studies included in this review mostly don't divide these groups. Only 2 studies do, and even then there are conflicting results. So one study showed that the chronic liver diseases is not correlated with a more severe progression of COVID-19, while the other show that show otherwise. So existing chronic liver diseases affects COVID-19 severity. So further research is still needed. Another issue is that there is still no cutoff value that has been agreed upon a hepatologist. And the included studies only Omrani Nafa et al. Show the cutoff they use, which is AST less or equal 30.5 unit per liter, which has sensitivity of 71.4% and specificity of 68.5%. And while this review is focused on the liver function test, which is conducted at hospital admission, we found that one of the included studies also use the liver function test abnormalities as a stratification system for patients in critical condition. So Zhang et al. Showed that hypoalbuminemia, or less than 40 gram per liter of albumin in critical patients, is correlated with worse clinical outcomes. This can actually be a result of inadequate nutrition, and therefore there is this implication of this abnormal liver function test for patient management. The first one is to ensure adequate nutrition monitoring, because while the hypoalbuminemia can be caused by inadequate nutrition, like I stated before, it can also be a result of COVID-19 severity. So this highlights the need of adequate nutrition monitoring. And the second one is to limit the hepatotoxic drug consumption in COVID-19 patients. And this includes drugs that are currently being used for COVID-19 management, such as steroids and several antivirus, such as remdesivir or lopinavir. So as a conclusion, liver function tests have the potential to be the prognostic factors of COVID-19 severity progression and should be considered in planning patient management. Our recommendation is to conduct future research regarding the clinical significance of liver function tests as prognostic factors of COVID-19 severity progression, and to specify the cutoff values of the liver function test results. These are our references. Thank you.